Can you describe what you are seeing on the ground in terms of deaths caused by hunger?
Yes, thank you. So I'm speaking to you from our health clinic this morning. This is our lab facility. And downstairs we receive up to 150 patients a day. And on top of that, a lot of mothers and children coming in for nutrition services. What we've seen from our work here in Gaza is that the situation is critical, and the rate that it's deteriorating is astonishing. Just a couple of months ago, we were seeing rates of 19% of children in our clinic that were representing as malnourished, but over the past few days, that has gone up to 32%. And already 19% was a horrific amount of children in terms of the nutrition situation, but 32% is incredible. We are struggling in terms of being able to respond to this. We have therapeutic supplies to address severe acute malnutrition, but we do not have any more supplies left of the supplements that would prevent children from sliding into that scale. So we really cannot, support them into the way that we would like. We've seen people fainting in the streets. This is affecting our teams as well, coming to work without any food. If they're lucky, people are eating up to one meal a day. But fundamentally, there's just no food in the market. So even those that are lucky enough and fortunate to be still earning a wage and have access to some funds, there's just nothing for them to buy, so they're in the same situation.
Yeah, so even people you're working there with, trying to help the Palestinians in Gaza, you're even struggling to get food, right? How is that affecting the work that you're doing? How are you and your team coping?
Yeah, it's extremely difficult. The team are extremely passionate about what they're doing. They're really motivated to continue the support. But just the level of efficiency and effectiveness we want to reach to, and we know that we can do in this situation, we're just not able to deliver. On top of that, it's not just the food situation, it's also access to water, both for drinking and washing, because this is reliant on fuel, and we're not getting the life-saving amounts of fuel that we need every day to be able to continue to deliver those services as well. So particularly in these types of temperatures, it's around 34, 35 degrees Celsius right now, and up to 90% humidity. It's increasing the famine and food security situation to incredible heights as well.
Yeah. Of course, Israel announced a one-week humanitarian pause in parts of Gaza to allow some aid convoys and limited food and medicine and fuel to come through from a single crossing. From your perspective, is that a meaningful breakthrough or just a piecemeal solution?
So what we're calling for with the humanitarian community is much wider access. We have so many trucks waiting outside. We know we can deliver at scale. We just need to be able to bring those in. Considering the severity of the needs at the moment that we're seeing, a one-week pause is not going to make the impact or be able to address any of those nutrition or food security needs that we're seeing. We would just be back in the same situation in a week's time. So we really need a concerted, sustained access and ability to go to the people and to support the needs for a longer period than that, because this is a result of 2 years accumulation, and we need time to be able to address that at the scale we know that we can do as humanitarians.